Hello, everyone. Thank you for joining us today. My name's Adam from Juzo, and this is Jussi Karkela from 6D, the founder and inventor of 6D tape. This is an introduction to 6D and how it works. And the good news is I'm not going to say much else, and I'm going to pass over to Jussi, who's going to introduce himself. Then we're going to minimize the window that's got our faces on it so you can see all of the information. So over to you, Jussi.
Thank you, Adam. So I'm very happy to be here. So as Adam said, I'm Jussi Karkela, physiotherapist and clinical and sales director of the 6D tape. And I'm gonna tell you now a little bit about our innovation, which is called 6D handle tape. And so our company is based in Finland. We invented or started already invent our magnificent 6D handle tape 2016. And today I'm happy to tell you that we have a patented class 1 CE approved 6D handle tape in our use. And the other product family, what we have is the 6D action negative cupping device that I'm going to show you a very brief video as well.
Yeah, thank you. And just for people who don't know, like myself, obviously here we've got the tape and here we've got the cupping.
Yes.
Cupping's been used for years and years and years, yeah?
Definitely, thousands of years.
That's fine.
Here are the founders of the company, Tapani Taskinen on the left and myself here on the right. And basically, I'm a bit of a different kind of a sales and physiotherapist because I've been working within physiotherapy already since 1989. And I always want to study and really work on hands-on techniques to really see that our innovation is working. So basically, we have two parts in the training today, but we are not going through that all. So you are more than welcome to come our online trainings, either for the 6D tape or for the 6D action negative cupping.
Yeah, and on the website, you'll actually see a button below that will take you to a sign-up page for that.
So we have now today, we have a little bit of the theory first, and then we have how you really use the 6D tape. So let's roll.
Okay. No pun intended.
No. And so if you just click on the video on, so basically we start quite often the 6D taping by manipulating the left venous angle, the lymph nodes here. This is to activate basically the lymph circulatory on 75% of the body, and I will tell you in a minute why it is so important, the left one. You start there with the 1 minute application, manipulation, 10 to 15 times. So then after that, you go into the target area, which is now on this video, a low back operation, which is about 3 weeks old. You can see on the middle of the one handle strips, there's about 5-6 centimeter length of a scar. And there's been some edema, some swelling. So I placed the tape around the target area. I also actually did a little bit of cupping there as well, just to try a little bit away the swelling first. And the 6D tape is a self-care tool. So the patient continues at home to do the treatment.
Yeah. I think from my side, what's nice is it's always good to go and see the physio. And then unless you have a lot of money, certainly in the UK, you don't see the physio for 7 days, 10 days, whereas you can continue the good work that you've done. So yeah,
absolutely.
Sorry to interrupt.
Absolutely. So this is the idea that it can be placed also by just watching a video you purchase, or you get the 6D tape self-care. And then you just apply the tape. So as seen there on the lower back, you do around 5 minutes manipulation there to suck the liquids, the swelling away from the area. And then you end up the session here on the same lymph nodes on the left side for 1 minute to, so to speak, to flush the toilet or empty the pockets, as the lymph therapists would say.
Okay.
Yeah, let's have the next slide.
Yeah, let's hope. Let's hope we can go on to the next slide.
So basically the 6D, it means that we manipulate the tissue up and down, side to side, back and forth, and the rotation on each axis. But we do it controlled, painless, and safe manipulation way. And let's do the next one, next slide, and I can show you there the small video coming up. And you can start it up.
Thank you.
And so here you can see that it is also very, very important that you go up and down. When you go up, you release some space underneath. You create the pathway for lymph liquids to flow better. And then when you press downwards, basically you are activating the lymph nodes, which is as well very, very important, especially in the beginning of the treatment.
And does it have any effect on the venous system? Does it pump the veins a little bit as well?
Absolutely, absolutely. Besides the lymph circulatory, it is like kind of like a micro massage what you are doing. So definitely it is accelerating the blood circulation as well, and fascia and different kinds of aspects of the tissue.
Okay, thank you.
And the second technique or core technology what we have on the tape is the adhesive. It is very skin friendly, as you can see from the left picture. You have it 60 tape, which is damaging very little the stratum corneum, which is the upper layer of the skin, especially when it's taken off. And on the right, you can see the conventional tapes. What is the damage basically into the tissue when it's done. And quite often regular tapes and adhesives start itching on the patients when the tape gets wet or the patient starts sweating themselves or they take a shower, etc., me included. So basically a small itch under and around the tape, but with 60 tape, nothing. And I'll have a video coming up here after this slide, how the effect really is. But thirdly, basically, as you can see from the green picture, it contours to the formation of the skin 6D adhesion. And therefore, it is also really good, excellent, the adhesion itself. It lasts from 3 to 10 days, which is the recommended time to keep it on the skin. And then when you compare it to the red one, all the conventional adhesions make a layer of strong and rigid adhesion. And then when you take it off, it really rips off part of your skin, basically, microscopically, which we can see now on the next newspaper test. So we'll put this one on.
Let's hope this works, because I've just put the laser pointer on, and of course that always makes it exciting.
Yes. And we can take the sound as well off. So the newspaper here is the skin, what we have, the tissue. And the black one, of course, represents now here the regular conventional adhesion or the glue. And when it's taken off from the skin, happens this one, as you can see. So it's really strong and it really tears a part of your tissue away. And this is, of course, microscopically happening. Then when you have the 6D tape, it's almost zero damage to the skin. Of course, it's not 100% allergic free, but let's say 99.5% of the people will not get any side effects.
Well, you can see it's only lifting the print, which is loose anyway. And having worn both, I can say that for sure it's less painful taking the 60 tape off. That's an absolute given.
Definitely. Yeah. So fourthly, we speak about the tape. So the bottom tape is elastic, skin-friendly kinesiology tape, which is 98% cotton, and the tape is elastic between the handles, not under the handles. As I told, it is designed to be worn from 2 to 10 days. But funny, once I had it on my patient's neck 5 weeks, because she was coming on a 5 weeks interval to my clinic. And I forgot to tell her, take it off in 2 weeks. But absolutely no skin rash, no allergies. Of course, the tape endings were a little bit crispy after the shower, etc. But still, she got so good results out of the tape that she wanted to keep it. Waterproof in number 4, as you can see. When you have a shower, you just tap with the towel, so you don't rub it. So then it holds very nicely on the skin. And as we just learned, number 5, it's really hyperallergenic, so suitable for highly sensitive skin. And no latex or rubber is used. Although what you can do is that as the tape adhesion takes about 20 minutes to adhere to reach the maximum bond, you can do the tape test and the in the beginning of the session. So maybe a half a handle or one handle somewhere in the body, then you can leave it on. Then you see throughout your session that there's no reactions within that moment. And then also you can show what is the strength of the manipulation when you start using it.
Okay, that makes sense. Thank you.
Then fifthly, we go into the handle itself. That would be the next slide.
The joy of
Here we go. So the handle material is really important. It has to be stiff. So this, our handle material, is made out of 100% polypropylene fibers, and they are actually the same fibers that are used for baby diapers.
Okay.
So very skin friendly. They are breathing, and first of all, it's non-flexible, because then when you take the handle, so it has to be on spot, and it has to be rather stiff, non-flexible, and then you can do a good manipulation out with the handle. And then the other here, number 3 to 6, the same as in the bottom material. So waterproof, hyperallergenic, and no latex on the handles.
Yeah, and to be honest, you'll see we've never had any reports of any hypoallergenic effects, any rash underneath. I myself got some tape on. I've been using it when I've been injured, and I do HIIT. Even though I'm quite old, I do HIIT exercises. I get a bit sweaty and nothing, which is great.
This is super. So last but not least, so 6D tape is a active self-care 24/7. As you can see from the pictures, where you don't have too many clothing, it is really easy to manipulate. But the idea is to manipulate the tissue in every 3 hours, because that activates the lymphatic circulatory. I have a better slide on that.
Okay.
But basically 24/7 when you are awake. Of course, you don't have to do it when you are asleep.
But you have something for that maybe in the future. So,
yes, we do.
But not for today.
Yeah. So basically, we have raised as a theory part the lymphatic system as the biggest, let's say, indication how it works. We improve the lymph flow, and we reduce the swelling and the pain in the area. And this is actually very little spoken, very little known. And if you don't speak of lymphatic trainers, therapists, but all the other therapists, doctors, they know very little about the lymphatic. But it is so important that basically we will die in 24 hours if it totally functions to operate.
I tell you a very, very quick aside. We had some American students staying with us last week. They're 14. I've got kids myself, they're teenagers. So when I did my A-level biology 40 years ago, in the textbooks, we had the red for the arteries and the blue for the veins. And of course, 40 years ago, you wouldn't expect the lymphatics to be in the textbooks. But even today, the lymphatics aren't shown in the textbooks, which is just completely crazy.
So this is absolutely crazy. Yes, indeed. Secondly, we work also with skin. So we manipulate the scars and the fibrotic tissue, and we increase the flexibility. And this is also very important that basically the scars are always reforming themselves under the tissue. The rest of the life, they are existing for you if you have operated. So it's good to manipulate the scars as well, especially if they are creating any indications for pain or tightness or these kind of things. And especially if they are on a dip, then you can really get it up still, even after 10 years.
Okay.
Thirdly, connective tissue. So the fascia, we manipulate the fascia chain, we reduce the constrictions. And then what happens for the muscles, joints, and nerve tissue? So basically, when we reduce the swelling, so in muscles, it happens that we improve the conditions for the satellite cells, which enhances the recovery. For the joints, we increase the viscosity of the hyaluronic acid inside the joint, which improves the lubrication. So all the joints are functioning much faster and better and nicer. For the nerve tissue,
no, I was just going to say, the gentleman that came to the office the other day, who was our IT guy, you literally put the tape on him. He had range of movement issues, and straight away he could move his shoulder, which was amazing.
Exactly. Lastly, the nerve tissue as well, which is really obvious. You reduce the swelling around the nerves, the pressure towards the nerves is less, and less pain, of course.
Great, thanks.
So the main indication segments, what you can see here, so we can work with lots of indications. For example, it can be a chronic or acute edema, swelling, regardless of the nature. We can work with it. Sometimes it can be a pressure wounds, also other kind of wounds. Of course, we don't put it on top of the wounds, the tape.
Good point.
All the pre and post operative. And for here, I can tell you that if you know that you are going to the operation, you should already start manipulating the day of the operation, because, for example, here on the neck, you so I have it here, the left side, the venous angle, 75% of the body on my knee operation. So I would be starting already here in the lymph nodes. That would accelerate the healing so much fast. The acute chronic injury, so if you fall down, you get bruising, you are really happy to use 6D taping, even exactly on the spot of the trauma or the damage, if the skin is intact, yes, and smaller pains and aches. And if we have a look for the next picture, so we have also here more indications. So you can use it for sports injuries, for neck pain, to release the tight neck, etc.
But please, pause the video and do check out the indications.
Yes. Then when we talk about the contraindications, so here we have some absolute and relative contraindications. So basically, they are the very same that we have in physiotherapy, lymphatic therapy, and massage. So if there would be any acute infections or the skin would be wounded, trashed, or anything damaged, no tape on the site, of course, as well as if there would be stitches, so we don't put anything on top of the stitches. Fresh blood clots, if there is an ongoing cancer treatment, so that's a absolute and relative contraindication. So if you are within chemotherapy or radiation, you have to wait. But then when you can come in hands-on techniques, you are able to use the tape.
But that's quite common in physiotherapy in general, right?
That is true. Okay. That is true. And then here you can see as well on the right picture that we have a lady with the arm sleeve garments. So you don't put tape under the garments, but you put it above, or for example, if you, in this case, she didn't have a glove, so I placed also one here on the hand, on the palm.
And she'd have one here, right? Under the
yes, I placed also one for the venous angle. And then if we do the next one. So basically, for those who are watching this and are not so known about the lymphatic system, so basically the function of our lymphatic system is to return these substances which belong to this lymphatic load. So we move those from the target site, from the extracellular fluid, back to the blood circulation. And this happens through these points that you are now showing. So the most important ones are here on the neck. Is the left one is the most important one, then would be the right one. Then we manipulate also sometimes with our fingertips, the armpits. There are lymph nodes there, and we don't place any tape there, but we can manipulate with the fingertips. Medial elbow sites are very important, and then the lymph nodes in the groin area, and then also the medial knee sites. And it is really important that we understand that basically whenever there is a damage on the body, the proteins cannot enter from that target, from that injury site to the lymphatic circulatory. And I have a good picture of that coming up here. So, so here you can see on the left picture on the animation. So basically we start moving, lifting, twisting the tissue, excuse me, and we start pushing the lymph liquids from the extracellular space into the pre-collecting capillaries, and then into the collecting capillaries, into the lymph nodes, and then finally on either side of the neck. So basically from there, they will then enter into the blood circulation in the end. And next picture shows really nicely how on a close-up picture. So what happens here on the left, that if you take it still one back.
Sorry.
Yep. So here you can see on the left picture that the proteins are collecting water. So through osmosis, they are increasing on their size. And then they don't enter, as you can see, the orange anchoring filaments. So basically we start opening up through those anchoring filaments, the endothelial cell host, these little gaps, and the proteins and the lymph liquids, they flow into the capillaries and they start traveling, as we have it on the next picture, I think. Yes, basically. Yeah, and so they start traveling into the lymph nodes. But what is also very interesting is that these capillaries start to automatically contract about 10 to 12 times per minute.
After you've
manipulated.
Okay, amazing.
And this happens for the next 3 hours. So basically, if you pump 1 minute here on the venous angles, on the lymph nodes, you get another 3 hours of activation automatically happening. So this is the recommendation why we recommend every 3 hours to manipulate. You can do more, but if there's no any side effects coming and you feel that it is doing good, good for you.
Thank you.
And
it's like driving an ocean liner.
And then one might ask that do we have any proof that we are really working with good innovation? So we did a imaging study, which is our scientific proof. So it took place 2019 in Belgium, and it was done with one healthy patient, and done with a lymphatic professor, Jean-Paul Belgrado. And here you can basically see on the picture, if you click it, it should start. There is a video. Yep, now it's going. Yep. So here on the right, you can see that that's the feasibility study. So we are manipulating one single handle here on the right, and the lymph is growing from the lower marker to the upper marker. And the whole study you can see then on our YouTube page when you go to 60 tape. And there's two versions, one 4 minutes short version and one 10 minutes full lengthy version, what you can have a look.
Yeah, and there's a link on the page as well.
Yes, and this basically kind of like proves that, yes, we are able to move the lymph in the tissue with...
And actually, this gentleman, Jean-Paul Belgrado, this is his field. He invented it. He's the world leader in it. So there is no better person to say it works.
Yes.
That's just a bit more on the study.
These are the pages of the study. And then we can have still the next one. We have also, by the way, also written report which can be obtained in English, German, Swedish, and Finnish. If you want to.
I have the English one, but I'll send them to you for the other languages.
So basically, we have also here in UK got into the book Your Lymphedema, Taking Back Control, as one method of treating self-care treatment. And here in the book, it says that it is proven to be very useful in self-management to help stimulate lymph drainage more proactively. Yeah. But beside that, it also extremely effective helping and releasing the tight scar tissues.
Okay. Yeah, and this is a good book. And if anyone with lymphedema is watching this, please do join and support the Lymphedema Support Network.
So then when we look a little bit about the results, so basically here we have a cancer patient, a lymphedema arm, and the treatment is done only 1 hour, 60 minutes. And you can see before how it is, how the edema, the swelling is in the hand.
Yeah.
And then the next 2 pictures during the treatment, and then the final result afterwards. So quite a remarkable reducing in swelling just in 1 hour.
Yeah.
And this is happening often. Then if we think about other indications, so for example, C-sections have been a really hot topic lately. And basically you can go on top of the C-section scar 2 to 4 weeks after the operation.
Okay.
But it is already as important in the C-section case to start manipulating already the operation day proximal. So basically in this case, you could have the venous angle on the left plus both groin lymph nodes, basically, because it is the gravity is also pushing the lymph liquids down, and then you can really manipulate. If it's the case of 5-year-old C-section scar, which is still constricting, giving you some troubles on the stomach muscles, then you can just place the tape on top and manipulate without the lymph nodes, because there's absolutely no swelling, but the scar itself is
So just for my clarification, we have to make sure that the scar is closed and it's safe, let's say. However, as soon as you have the operation, you can stick one up on the left venous angle and one in each groin, and you can pump those.
Absolutely.
It will have a good effect on the inflammation here. When the scar is closed and your therapist says it's okay to put something on top of it, then you can put the 6D tape on there as well.
Absolutely.
Okay, thanks, you see.
And then here we have a result on the wrist scar. So basically above the dashed line, there's been tape, as you can see, even the glue lines. So there's been tape from Monday to Monday above the dashed line, and nothing underneath. So I think the picture speaks by itself. That's quite.
How old was this scar?
It was really recent when it was manipulated, as you can see. Yeah, it's still a bit red, and here's an example. If you click the next one, so the video starts, and our German trainer. So there was a knee replacement, and he was taking the patient 2 days in a row to the clinic, and that was 2019. So basically there was the problem of range of motion, swelling, as you can see, and also some pain. So Christian did that. He placed only one tape on the left venous angle. And the client was manipulating the venous angle as it comes now here on the video. 5 times a day, around 5 minutes per time. And the result was 2 centimeters smaller knee circumference just in 1 day. And with only that one single piece of handle. Of course, this was very beginning as we started with Christian. So you could also, of course, place already into the knee because it's healed, the scar. So you can go on top of it, and especially on the medial side, as the lymph circulatory, it's more dense.
But it was a new therapy then, and people were a little bit scared, weren't they? So they went for the minimal amount to put on the.
This is our case in Helsinki University Oncology Department. So a breast cancer patient, and her both breasts were removed. They were replaced with silicone implants. But as you can see on the especially on the right, on the left, a little bit of both breasts, the skin was attaching to the silicones and creating pain, and also some postural negative sides. As you can see, they are tilted a bit forward, and so she started using on different sizes of tapes, and she got really big help out of the tape. So then she ended up using it also in other indications as well.
So on this lady, she has got some tape on the left and on the right. Why is that?
Well, this is basically also, thank you for asking, because you can have both, like two handles on the venous angle or one handle.
Yeah.
The two handles might constrict a little bit of the movement of the neck, but if there is a lot of swelling, for example, on the arm, and you are driving that away, then it's really effective to have two. But one is also good. There's less muscle constriction, and it really activates the.
But this one is controlling the return.
Yes, on the right side. Yes, yes, right. Definitely. Yeah, good. And the left one, of course, from the left side.
Okay, thanks, Jussi.
And we can skip this one as well. And so. Besides the 6D tape, so we have also invented, as I said in the beginning, a 6D action negative pressure. And it is a very simple cupping device, but it is precisely controlled, as you can see. You can use it from 0 to 400 millimercury with a very nice turning knobs, easy to handle, with 3 different modalities or techniques to use. Pulsation. Then you have the lift and twist, as you can see, while it's doing the suction. I'm lifting and twisting the cup. And thirdly, the gliding. Then either with a static cup here, as you can see, and then in the following slide, a roller gliding cup.
I mean, what I like about the clear cups is that you can actually see what's happening on the body, and the first time you see it, it looks scary and you think it's going to hurt, because obviously if you pull your skin up that hard, you feel it, but it's surprisingly nice. And even when you put it on 300 or 400 millimeters of mercury, it doesn't feel like it's bad. You know, it's really unusual, but the recommendation is to start low.
Yes, absolutely.
And say, how does that feel? How does that feel? And twist the dial.
And then
because
increase.
That for me is one of the benefits of that machine, because you can literally be holding your cup on the patient and changing the dial at the same time. Whereas, you know, the older things that were out, they were touch screen, and you can't do it.
Definitely, we have 19 cups, so you can go all the way from 3 millimeter treating your eyelashes from 85 millimeter to low back big areas, and so it's very handy.
I mean, I'm sure it's a bit like a washing machine, that you have your favorite cycles, you have your favorite cups, but it's great to have those small ones for doing, even in between knuckles and things.
Absolutely. You can even with our 60 cupping device, you can even have a taping underneath, and partially you can do the suction, even a little bit of the tape inside the cup, and it's still functioning.
Okay.
So let's have a look for how you really work with the 60 tape. So you have the treatment protocol. So basically, as I said in the beginning video, so you start from either side of the venous angle, and in 75% of the cases, you start on the left. And for example, if you would have a right knee problem, you have a 1 minute or 10 to 15 manipulation on the left venous angle. Then you go into the lymph nodes in the groin above the injured knee for the same amount, about minutes. Then you go to the target area around 5 minutes.
Yes.
You manipulate there, and then you return the same pathway up, because we first activate, then we start the suction, the drainage, and then we flush.
When we talk about, when I talk about it, because I'm not the cleverest sometimes, I always say it's like a car park. If the car park's full, there's no point sending more cars to the car park. So empty the car park, send the cars from the next lower bit to the car park, send them from the knee to the now emptied groin car park, and then work your way backwards.
That's nice. Yes, exactly. And then also, if you are a lymphatic drainage therapist, this is also very well known that you can use the watershed areas. Sometimes in the cancer cases, they might block the lymph liquids flow into the next area. But we have basically 3 lines. So we have the vertical one that divides the whole body into 2. Then we have the upper horizontal watershed area, which divides the upper part, and then the lower horizontal watershed area. And these little blue and white arrows actually shows you the next exit place for the lymph liquids. So for example, in the low back, it would be the groin lymph nodes. So partially the lymph liquids will go into the blood circulation there, but most of it will anyway travel on the left side of the neck. And on the thoracical region, you can see that the armpits are really important, the lymph nodes. And then finally, in the end, on the upper region and head, it is the neck side.
Okay, great.
And here we have now the biggest, maybe it's just one word of this.
Oh, sorry.
So the ductus thoracicus, which is the biggest lymphatic vein, and as you can see, so this is the reason why the left side is so important. It drains from both extremities, the lower body and the whole left side of the body, and it ends up there to the left side. And the right side is controlling the 25%. It's only the upper arm, the right arm, and the upper quadrant of the body.
Okay, that's really good.
Yeah. So let's have a look. So we start up this video. So basically, when you start the taping, you shave. And recommendation is that if you know that you will tape your customer, ask them to shave already the day before.
So that the skin's not
the skin is
broken.
Not so broken.
Right.
Regardless if you shave or not, always clean it. The skin has to be clean, room temperature, no sweaty, and no hair.
Okay.
Then you cut the needed length of the tape, or you use the pre-cut pieces. It's important that the end of the tape is rounded so that it doesn't get caught by clothing when you put your clothes on and off. And you have your joint in a slightly bended position. So not totally straight, but how it would normally be. Muscles relaxed. You cut the back liner of the tape between 2 handles, and you pull the back liner to the sides. We don't stretch the tape. We place the middle of the tape into the indicated target area in the middle of that. And then you place the tape. You stretch the tape if you want to make a small slight turn and avoid wrinkles. Then you stretch, but just 15%, 1/5. So very, very little. You press it very firmly. This is also important, and it adheres in 20 minutes to reach the maximum bond.
Okay.
Then when you manipulate, you never manipulate, excuse me, so much that nor the handle nor the bottom tape would come off.
Yeah.
and so that's one kind of like.
I mean, it's kind of obvious, but people do pull when they get addicted to
they
it.
do.
So,
And when you remove it, then you just rub it, warm it, and then alongside the skin, you try to roll it as gentle as possible off from the skin. And as you, Adam, said, so when we did invent the tape and we're testing it, so you can really do a muscle damage so well it is adhered to the tissue.
Okay.
If you have a muscle and you really use force on the tape.
Yeah, I mean, most therapists would know that safe removal is important because they're used to using dressings, and not every dressing is a silicone dressing.
Yes.
Yet. It's quite close though.
Yeah, so here's just the 15% that I say once again. So only 15% when it's needed to avoid wrinkles or just a small turn, because our philosophy in a way with the tape is that it should be on skin as relaxed as possible.
Yeah.
If you feel that you get, for example, with a muscle stretching technique, a better result, that you stretch the muscle to the longest as it goes, and then with 0% you place the 60 tape, you are more than welcome to do that.
Yeah.
But as I say, there's never only one solution. But most of the injuries actually happen when non-therapists, when they stretch the tape maximum, they apply it to the skin because they think that it gives you more results. But on the contrary, it actually gives you blisters and skin
but that's
damage.
the same with kinesio tape as well, isn't it?
Exactly.
I've got some on here, and it's been on since Tuesday, and I think it's going to last 7 days. I usually get 7 days out of it, but also I'm demonstrating it every day. So consequently, I'm manipulating it a lot more than the average person would. So I'm happy if I get 6 or 7 days because I'm constantly lifting and twisting it, whereas the average person will be doing it.
Yeah.
Well, if we're lucky, 3 or 4.
Yeah, and it's funny. It's also, as you mentioned, there's also this kind of like an automatic, let's say, vibration, because when you have the tape under the clothing, we've got some feedback from the clients and customers that basically when the clothing kind of like moves, so they move the tabs underneath, and it gives you kind of like a
micro massage,
automatic micro massage.
That's what we say about flat knitted hosiery as well.
So. Yes. So let's look the next one. We have some. So what we have is that we have certain self-care instructions. These are all downloadable, so you can have a look for treating the scar and swelling after the breast cancer operation. This instruction is also as well good to any scar or swelling. We have the latest one is the carpal tunnel and the Gerwine syndrome, the thumb nerve inflammation or operation. There are instructions for that. We have for the knee indications a instruction package, and then also for golfer and tennis elbow as well. Quite commonly, the therapists they purchase or they get the 5 meter roll, what they just cut to the needed length, what is then desired. And we could actually take the well, I could tell here a little bit about the treatment protocol. So basically, as we speak about now, for example, a tennis elbow or golfer's elbow, we start with 1 minute there, 10 to 15 manipulation on the neck. Then when we go on the 3 handles downwards, we lift, lift, and lift. So we create space underneath. And then when we come from the lowest handle upwards, then we start also pushing and squeezing, and we basically squeeze and guide the lymph liquids into the armpits and then into the venous angle.
So it's the empty, 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 and then push, 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 push and twist.
And then final empty on the
makes sense.
Yeah. Let's have a look for the other one, the tennis and golfer's elbow. Okay, we can take the next one still. Yeah, so here is probably some of the people also asking that, so what is the length that you would need to use? And here on the left picture, you can see that basically we recommend from 1 handle to 3-4 handles, because as I told that the handle is stiff. So it might restrict the muscle function or the joint function if you have 4+ handles. And in addition, it is also easier to replace a 1-handle strip than 5 handles in a row.
I mean, from my own personal usage of kinesio tape, I mean, the elbow, it bends over 100 degrees. I'm not a physio, but I think it's like 135 degrees you can bend it. So if you put anything over the full elbow, it always comes off. So to me, I mean, yes, it would be lovely to see a nice long piece of fabric, because, I'm used to seeing an arm sleeve or something there. But actually, this makes a lot more sense, because if this bit was scraped off by clothing, let's say you were wearing a tight jumper, well, at least you're not having to replace a whole arm as well. So
definitely. And especially when you have a little bit of space, the skin between the handles, it is more comfortable and it is more, I would say, more effective to do the manipulation. As you can see here, you can place vertical or horizontal the tape. It doesn't matter. The main indication is that how the patient gets the best grip out of the handles.
Okay.
That's more or less kind of like, and here on the right picture, you can see that you can also cut it to the smaller size. So this is, for example, around 1 centimeter out of that 5 centimeter width of
and
the tape.
on the face here, because we always say that head and neck lymphedema is really tricky anyway. Obviously, it can help with any scarring or swelling there anyway. Do you start on the, well, of course, the lymphovenous angle on the side of the face, but do you then start on the lower one and then the top one?
Yeah, basically, good question, Adam. So what is missing here on the picture is as well, of course, the venous angle on the neck. So you would first activate and open the pathway, so to speak, and then you work towards the target by opening up and then coming back, as we went on the tennis elbow as well, and then finally. Here you can see also some different types of tapings on the right picture. You have after a radiation therapy cancer patient on shin, cancer in shin. So basically there you have to wait several months before it is sensitive enough to place tape on.
But that comes back to something, you know, we speak about sometimes, which is when it's safe to use and when it's not safe to use. You wouldn't put it on someone who's undergoing current radiotherapy. They have to be in a safer place, although they'll still be getting therapy.
And this is also quite interesting that then when you have here, you can see I have 1, 2, 3, 4, 5, at least 5 handles in a row. But when you cut it into the lymphatic form, so then it does not constrict the muscle function so much. So then the lymphatic taping is a bit different than on the length size compared. On the middle picture, you can see the shoulder taping. So this is actually the same what I did to your IT, Kai, as well. I have 4 handles there. Underneath, 1 full handle, and then the 3 other handles are cut in half. They go around the deltoideus muscle. And then I have kind of like 3 handles directly on top of the joint to manipulate there. And you never end up tape over tape. So basically the ends of the tape has to be on a,
because then it would be double the height and it's more likely to
and it's not then when you manipulate the middle handle, which is on top of the other tape, so then you do it a bit more careful because it's not attached as well. Here a lymphedema arm with different lymphatic tapings all the way to the palm of the hand. So the carpal tunnel, we could take the video of this, so we briefly go through this.
This is the one, right?
That's the one, and then you can even take it to the halfway.
I don't think it's going to let us do that because of the setup.
Okay. Well, then I can discuss through that. So here, meanwhile, as well. So you can cut it lengthwise as you desire, and then also widthwise. So that 5 centimeter can be cut even to maybe in 5 small pieces if you do fingers, for example. Here,
sorry, it stopped whenever I clicked someone else.
So here I have 1 full handle for the venous angle on the affected site. I have 2 handles for the medial elbow, and then for the target area, I have 2 handle which is cut into half to 1 handle. And here, basically, when we look, the venous angle tape comes above the collarbone, so it comes into the soft spot on the neck. And most of the time, people, they turn their head to the side, and then you have already a muscle stretching here, which is not desirable, at least on that tape. And then, therefore, you tape in the neutral position, head straight forward, muscles relaxed as well for the other tapes.
Yeah.
So now you can see the collarbone, it's dotted with ink. Once again, when you before you do the actual taping, shave rather day before,
Yeah.
clean always, and then and it's quite interesting because quite often it's good to have the clothing off for a while because the tissue it's normally it's warm underneath,
Yes.
and so that it reaches the, let's say, the optimal room temperature, and it's not sweating.
Just a stupid question. You've marked the collarbone. That's just so we can see it on the video.
Yes, that is just to see.
Right.
Yeah. Don't place it too close to the neck. So quite often one corner of the one handle tape comes in top of the collarbone, depending a little bit of the size of the person being taped. And now when I remove the back liner from the one handle, you can see that the tape is stretching between the handles. So I take a small tiny corner because it's easiest from there. With one handle strip, you remove to the sides, not totally off the bigger piece, and then you remove the smaller one. We don't touch with hands the glue, and it's safe to apply. And then you place it just into the dip, into the above the lymph nodes. Quite often I hold it from the handle so that I don't by accidentally pull it to the side or stretch into it. And then this one is nice to place vertically because then you get a nice grip.
It's easier to grab
out of it. And then the medial elbow, two handles. Whenever you have two or more handles, so you rip it off the back liner from the middle of the tape. And now, if this is constricting the function of the elbow joint, you can also have an activation tape, one or two handles above the joint or under. So then it's kind of like a little bit less stress on the elbow area. And remember also always to press it well enough. So first, gently to avoid wrinkles, because if you do it rapidly, a wrinkle comes so fast that it is amazing. So from the middle of the tape towards the ends, so that it really glues well.
Okay.
Then you go into the target area, which is now here a thumb nerve inflammation or operation.
Yeah.
So you measure a little bit that the ends of the tape are not coming too long, because then once you've pushed it and really smeared it to the tissue, you can't remove it anymore. You cut the legs, so between those two handles, you remove the back liner, as you can see there. Then I do the final kind of measuring still that, okay, the legs are good. Then I start with the one full handle to remove the back liner. And you can see here that our tape works a little bit different. So we don't have that 10% pre-stretch on the tape like regular kinesiology tapes have. So you can pull the back liner alongside the skin.
Okay.
And you still have don't have the stretch.
Yeah, so it's literally being applied with the V. I always call it the root, the very root of the thumb. And I could imagine that although we say the tape generally stays in place for 7 to 10 days, we're probably talking 3 to 4 on the palm.
Definitely on the hands, because you have to wash your hands so frequently. So there it would not stay for that.
And it looked like you were just trying to manipulating the tape there to say, don't get any creases in it as you go over the top, the dorsum. And then you kind of like with the other finger, at the meanwhile, while you stretch, you kind of like press it then to the final position. This reminds me, for those who've done wound care, there's a product called a hydrocolloid, and some people just slap it on, but it never stays on as well with those who smooth it down, with the heat of their hand. And for me, if you take the right time or enough time smoothing it down, it definitely should stay in place longer as opposed to just sticking. So the stick can manipulate it a bit, almost heat with your blood the glue into the skin of the patient.
Yes.
So okay.
And here you can see the protocol,
yeah.
pumping, lifting, twisting. It's really important that the lymph nodes are there in deep so that you also press down, not only to the upwards directions. 1 minute, 10 to 15 peaceful manipulations.
Lifting to begin with.
Lifting and also pushing on the venous angle. So that's kind of like the
but
activation.
In the elbow.
In the elbow as there as well. So we are kind of like lifting and pushing, activating in a way the area.
Yeah.
And so, and there you could also pump the armpit with your fingertips 10, 15 times. Then you go into the target area.
Yeah.
And here, as it's a little bit smaller, as just 2 handles, so you can just go 6-dimensionally on each directions, and around 5 minutes there on the target area, and you manipulate the tissue.
If you weren't being taped, what's the usual treatment for this? Do you have to have like a thumb spiker or something?
Yeah, quite often you might have quite often you might have a cast on kind of like a removable splint or something to create. And then with the 60 tape we can also prevent, for example, the movement. So if we tape the 60 handle tape here, the 2 handles are stiff, so they are basically giving you a bit of resistance to the directions which you don't want to move the arm.
Okay.
And then you return the same pathway, and then you flush up empty the bucket up there in the tissue.
Okay, great, thanks.
Forward. And that's for the knee. We could just tell from the right picture here that basically, so this could be a jumper's knee taping. So not only 3 handles on both sides, but then also to activate and to manipulate the patella tendon.
Yeah.
So this could be one solution. Okay. And this, by the way, also 3 handles on both sides of the knee. If it's an instable knee, so it's kind of like a brace type support.
Yes.
Of course, not as sturdy as the metal frame brace or even without metals would give, but very much support.
Yeah, I mean, for us as Juzo, we're all about freedom of movement and freedom of motion, and we don't really believe in limiting range, unless of course it needs to be. If it needs to be, I don't want to sound stupid, but being able to move is significantly better than not.
So then on the contrary, on the protocol compared to the upper extremities, so here you can see that we start on the left side of the neck, like on that picture. Then we go into the groin above the injured area that we want to treat. And then we go to the target area for 5 minutes round, and then we return the same pathway up.
Yeah. Okay. No, I think that's certainly come across for me is start at the top, work your way down, work your way back up.
Yeah. And this is especially in the case of swelling or edema, but maybe sometimes for a sports person, if you want to kind of like do a recovery after a heavy workout weekend or competition, because then it's not swelling, but you actually accelerate the whole lymphatics. But then if you have a scar and pain because of the scar tightness, then you can just work on top of this, the scar.
I'm going to skip through this one if that's okay.
That is absolutely, and we can see what interesting else there we have here in the end. Here you can see hamstring, a little bit of skin between. So instead of 4 handles in a row, this is much more comfortable for the client. Athletes, for example, here is an example of our top 400-meter runner who got in the beginning of the season a small tear on the thigh muscle, and in the end of the season he was running his best record while 60 taped. So
that's always nice to say.
Indeed.
Well, he let you use the picture, so it must be true. So that's good.
It is true. It is true. Yes. So once again, no one only right solution application taping for one injury or area. So you can do different tapings. The plantar fasciitis, it's really difficult to tape and to have the tape staying on the bottom of the foot. So here you can see in the middle picture that I have taped some support tape around so that it holds there as long. On the right picture, you can see my arrows there. So basically, in the Achilles tendon, I have cut the full handle into half. It forms nicer around the Achilles tendon. And then here on the knee, on the heel, then you have, I have actually cut the handle off totally. Because I don't want to manipulate there. I want to manipulate on the bottom of the foot.
Well, I would never have thought of doing it, but it makes sense because the handle's rigid and it doesn't stretch. So by cutting it, it allows it to go around the bend. Yeah, great.
Different types of foot applications. So it can be one full handles or Y-shape or even lymphatic.
Okay.
Different neck taping. So here on the spinal cord or around spine, so you can have a little bit longer. They are not that constricting, but depending once again a little bit of that.
And always nice to have a willing partner if you are back at home and you need someone to take you up there.
So once again here, some indications, for example, arthroscopy operation on the middle picture. It's done, and you can see still the stitches on. So we don't go on top of the stitches, but on her case, we were able to remove just activating the venous angle here in 1 week, 6 centimeters. So the whole swelling was gone in one week.
Amazing.
On the left picture, you can actually see that sometimes it's hard to the problem area was here on the back of the shoulder. And to reach there is through the front handles because they are moving the back handles.
So pulling this just pulls over
the whole range.
Yeah, I've noticed that myself.
Here is actually on the right upper corner is the video picture. You can see now there the scar, which is 3 weeks old, and
sorry, I thought it was
no video, and then basically this is also constricting very little. I have 5 handles here on the low back, and once again, if you don't have so much movement on your shoulders from the ends of the tape, you are actually moving the whole area.
I mean, it doesn't matter there, does it? Because it's if you'd applied the tape this way over the bend at the back, then
But this is actually so healed already that I could have placed on top, but I wanted to kind of like spread it. The more it spreads, the more effect there it is for the area.
Okay.
This was a sports injury. Actually, she slipped on a watery green, so the whole thigh muscle was ruptured.
Nice.
9 weeks, no bending of the knee and the metal frame, the cast, crutches. And she actually started already the operation day working on the venous angle and the groin, and there was very, very little edema, very little bruising on the knee, and she was really happy. I think it comes in the next picture.
But that's a nice scar now. If there is such a thing.
Yeah. So then here I can show you that. So you can go immediately around 2 to 4 weeks on top of the scar or to the sides, depending how sensitive it is. In 6 weeks, the scar area or the muscle kind of like recovers the full strength so that then you can use the full force. But up to 6 weeks, you have to be careful. But immediately when it is possible, I do really recommend that you go as close or on top. Here, for example, with half handles, it's quite nice. You can do it very easily and change the tapes. And the next one is the lymphatic on the same knee. So then when you cannot go on top, so here you can see that I have already maybe 7 handles in a lymphatic form taped going around the knee scar. And then when it is possible, then you can just apply even on top. Or sometimes here on the right picture, you can see that there is regular kinesio connected together, combined with the 6D.
Okay.
We can still go on till the next one.
Yeah. So that's just
this is just basically
okay.
showing a little bit of what we just gone through here as well. So basically, these are the few last slides. So thanks to Dennis Hardy, he is one of the first users of the 6D tape and 6D action here in UK, and we are really happy with the results, and they are as well happy with the results what they have.
To be fair, we became interested when Denise became interested. You know, I don't want to say she's a stalwart because that always has a certain age connotation, and she's one of the nicest ladies you'll ever meet, but she's also one of the most respected therapists in lymphedema in the UK. So yeah, she's had great results with it.
We have it also, the tape in St. George, and they've got some really nice results, even with children.
Within the hospital. Because sometimes, you know, as a garment manufacturer, it can be difficult to consistently make garments that fit a child. So we'll make a garment, then they have a growth spurt, and the garment doesn't fit. And then we have to remake the garment. There's a price issue with that because garments aren't cheap. Whereas at least with this, you can have some consistency and work through the age of the child in this case.
Definitely.
Okay.
So this was basically briefly gone through, and as we said, you are more than welcome to come online to our trainings, and we can do also one-to-one trainings to your clinics if needed.
Great. Jussi, thank you very much. All the information should be below this video, and there'll be contact details there as well. Most of the training that's with Jussi will be done online because he's over in Finland. If it's in-house training that you need in your clinic, it will be one of the Juzo team that comes out. But thank you very much for attending, and wish you the best for the rest of the day. Thank you.